Hello, I'm Dr. Lane Rutledge. Many of you I know, and I am the biochemical geneticist, one of 2 board-certified biochemical geneticists in Alabama. For 20 years, I was only one of board-certified biochemical geneticists in Alabama. And we've heard a lot about PKU today, but I wanted to show you just one slide, which hopefully will be coming. I also wanted to mention Harriet Cloud. She's not here today, I don't think. But Harriet is a metabolic dietitian, and she treated all those initial PKU babies, and I don't think we could have had successful screening in Alabama without Harriet. She was recently inducted into the Alabama Medical Hall of Fame. And I want to reiterate, please do not call it the PKU test. I mean, that really can have negative results. We had a lady call us, and she was trying to get PKU formula for her baby because she'd been told the baby had an abnormal PKU test, and it was a completely different disorder. So please call it the newborn screening test. We have heard a lot about PKU today, and rightfully so. And I told Robert earlier I may not have PKU, but he's not the only one who eats a few too many French fries. But these are the diagnoses that we made in 2004. I'm too short. MCAD, we diagnosed 4 babies with medium-chain acyl-CoA dehydrogenase, and that's a disorder of fat metabolism. We diagnose usually about 2 patients a year with a hyper-Phe, which is lower levels than PKU, but still need treatment. 2 babies with galactosemia, and you can see the list here, and I won't go through what all these are, but this is to remind you that we screen for probably 40 to 45 inborn errors of metabolism in the state of Alabama. And the reason we screen for these is because these have serious complications if not treated. In the year before we started the expanded newborn screen, we had 2 patients, a 5-year-old girl and a 9-month-old boy, die of MCAD because it was not known that they had it. And had we known that they had it, they would have been in the hospital on IV fluids and they would have survived. So the reason we screen for things is to save babies' lives, and there's no doubt in my mind that we do that. And people kind of laugh because we think diagnosing 4 MCAD patients a year is a lot. You'll hear some other doctors speak today, and they diagnose a lot more than this. But these patients all mean a lot just because we know that we can make a significant difference in their lives. I wanted to introduce Mrs. Julie Tucker, whose daughter, Hadley, was diagnosed with PKU when she was a baby in 2011. And I'm going to stray from my script a little bit that Rachel gave me just to say that the Tucker family is one that you would want to trade me some patients for. You would want this family in your clinic. They've done an outstanding job. They're activists, and we just love having them as our patients in clinic. Julie?
Good morning. My name is Julie Tucker, and I live in Harvest, Alabama, which is just outside of Huntsville. My husband Adam and I have 1 daughter, Hadley, and she just turned 4, and she has classical PKU. In 2011, we were thrilled to learn that we were expecting our first child. My pregnancy went very well. There were no complications, and we were just excited to finally have the child that we had waited for quite a while. So on August 30th, 2011, Hadley Grace was born, and she was absolutely perfect. No breathing problems, no jaundice. She took to nursing right away. She was sleeping through the night very early on. So we had no idea that anything could possibly be wrong. When Hadley was 9 days old, I received a call from a very sweet lady at UAB, and she told me that Hadley had tested positive for PKU, and we needed to come to UAB the next day. That is the day that my life changed. I brought my tissue. I can't tell you a lot of details from the day that she was born, but I can tell you everything about that day that I received that call. Everything just kind of froze, and I was completely devastated. At first I was in denial. I remember asking if it was a false positive. I just thought there was no way that she could have anything wrong with her. She was just so perfect and healthy, and not to mention that nobody in my family ever had PKU. We were in the unique position of actually knowing an adult with PKU before Hadley was even born. This was a friend of ours. That's more than most people can say. Most people have never even heard of PKU when their child is diagnosed. This was a friend of ours who was married and had a job and was generally a very healthy person, so we sort of knew in the back of our minds that Hadley would be okay. But it was still very scary, and there was still a lot that we did not know. So the next day we went to UAB, and the first place we went was to the lab to get a blood and urine sample. And they had to stick the needle in the top of Hadley's hand to get blood. And at that moment, I remember thinking, you know, I should feel something right now. I should be upset about this because my newborn baby has a needle stuck in her hand, and of course she's crying and screaming, and I was just so numb at that point that I couldn't even process it. So after we left the lab, we went to meet with Dr. Rutledge and our dietitian at UAB, and they told us more about PKU and gave us a special formula that Hadley will have to drink for the rest of her life. She, like Robert, is on Phenylketonuria right now. So I was very overwhelmed that first day with all the information that I got, but I was thankful that they took their time with us and didn't rush us. I really appreciated that. And I will never forget what Dr. Rutledge told me that day. She said, "You need to grieve about this before you can get to a place where you can say, okay, I can do this." And she gave me permission to be sad, and I appreciated that. A lot of times, you know, well-meaning friends and family will tell you, you know, it could be so much worse, which it could, but when you're a new mom, you really don't want to hear that. And so I really appreciated Dr. Rutledge telling me that. It's hard to put into words some of the emotions that I felt that day that we learned that Hadley had PKU. It can be a very lonely experience. Sometimes it's hard for me to relate to other moms who can feed their child just whatever. And it's hard for other moms to relate to me as a parent of a child with any sort of special need. For me, guilt is something that I struggled with, and it's irrational, but those of you who are parents will understand. You know, my genes did this to her. I gave this to her, not intentionally, but I did. You know, the first 9 days of her life, I exclusively breastfed, and breast milk is very high in Phe. So, you know, I feel like I essentially was poisoning her brain for those first 9 days of her life. And I know that's not long enough to do any real long-term damage, but, you know, again, those of you who are parents, you'll understand. And parents who have never heard of PKU before, or any other condition, you know, will understandably go to the internet and search. And so I actually typed in PKU a couple weeks ago just to refresh my memory of the information that's out there, and it's pretty scary. You know, it talks a lot about what can happen without treatment, and so you can imagine how frightening that must be for a new family. So today, Hadley is 4 years old, and she is, in my opinion, brilliant and hilarious and incredibly healthy and happy. Every milestone she meets and every new thing that she's able to learn, I owe it all to newborn screening and to early treatment. So I would like to share a little bit about what our daily life is like with PKU. Every day Hadley gets a certain amount of Phe. She gets an allowance of milligrams of Phe per day. And so everything she eats must be weighed and calculated. So everything we do is basically planned around her meals. We have to make sure that we're home at mealtime, you know, because not many restaurants have things that she can eat unless we plan in advance and take her food with us. Travel is difficult because we have to take her food and her formula with us wherever we go. We also have to be a little extra careful about sickness, just because when she's sick, it can cause her levels to go up. And the most important part of her daily diet is her formula. She gets a specific amount of formula every day, and we have to make sure she drinks it all because it's very important. And this can be tricky with a child who is very young and would rather get up and play than sit down and drink her milk, which is what we call it. One of the most difficult parts about PKU is the lack of insurance coverage for medical foods and formula. For us, 1 can of formula costs about $40, and it lasts about 5 days. A bag of low-protein pasta is about $10. A loaf of low-protein bread is about $12. So you can imagine what a financial burden this can be on some families. We also do finger sticks at home once every 1 to 2 weeks to check her blood Phe levels, and I know you all are familiar with this card. Thankfully, Hadley does great with her finger sticks, and she doesn't fight them at all. She likes to go to the store and pick out her Band-Aids, whatever works with a 4-year-old. So our amazing dietitian gets those levels each time and calls me with the results, and we make any changes to her diet or formula that we need to. And we are very grateful that the lab here in Alabama is willing to do those blood levels on these cards. It's a huge blessing to the families. Without that service, we personally would have to drive about 2 hours, every 1 to 2 weeks to go to the lab, have a full blood draw, which can be very traumatic to a young child and their parents. And each time we would have to pay a $175 copay each time we go to the lab. So that would be a huge financial burden, on top of the food and formula. So this is not something that a lot of families could afford to do financially or time-wise. So without the service that the lab provides, my fear is that a lot of families would not be able to manage their child's diet as well, and the child would suffer as a result. So on behalf of all the PKU families in Alabama, I'd like to say thank you for providing that service for us. We really, really appreciate it. So when I was pregnant, I remember getting a pamphlet on newborn screening, and that was about it. My doctor did not talk to me about it. I wasn't told in the hospital when they had done the test. And I wish someone had talked to me about how crucial it was, not to scare me, but to inform me and educate me. And that's one thing that I try to do now. Since Hadley was diagnosed, I have made it my personal mission to educate people not just about PKU, but about newborn screening and how important it is. My friends will tell you if they have a new baby, I will pester them until they get those newborn screening results back. A lot of times if they come back inconclusive, sometimes either the family or the pediatrician is not always as diligent about getting a repeat test done, and that's unfortunate and potentially very dangerous, as you all know. So I have worked with the National PKU Alliance, various fundraisers. I also traveled to Washington, D.C. with them in May to lobby for a federal bill that would require insurance plans to cover the cost of medical foods and formula. I'm also a member of the Southeastern Regional Genetics Group Consumer Alliance panel, where I represent the state of Alabama. And I recently formed a nonprofit organization called Alabama PKU Foundation to connect PKU families and provide support for them. 4 years ago, I never thought I would be standing here today. PKU has become a blessing for our family. It has given me so many opportunities, and I've met some amazing people, some amazing families, and I've been able to educate others about PKU and newborn screening, and I'm very thankful for that. So thank you for allowing me to be here today to share our story with you. And if anyone has any questions today during the conference, I'd be happy to answer them. Thank you.